Welcome to 100-Year Health, a channel dedicated to understanding the human body, healthy living, and the science behind everyday health questions. Have you ever noticed that one of the very first signs of getting sick is a strange soreness in your throat? It might start as a small, scratchy feeling when you swallow, a dry irritation that wasn't there earlier in the day. At first it may seem minor, but over the next few hours, that irritation can slowly grow into a clear sore throat. For many people, this is one of the earliest signals that the body has begun responding to an infection. Interestingly, this symptom often appears before other common signs of illness like coughing, fever, or congestion. This raises an interesting question. Why does the throat react so quickly when the body is getting sick? To understand this, we need to look at how viruses typically enter the body. Many respiratory viruses, including those responsible for the common cold and influenza, enter through the nose and mouth. Every time we breathe, talk, eat, or touch our face, tiny particles from the air and environment can reach these areas. The throat sits at an important crossroads inside the body. It connects the nose, mouth, airways, and digestive tract. Because of this position, it often becomes one of the first places where incoming viruses make contact with the body's tissues. The lining of the throat is made of delicate tissues called mucous membranes. These tissues are constantly exposed to the outside world. Their job is to help trap and remove unwanted particles like dust, bacteria, and viruses before they travel deeper into the body. When a virus enters this area, it begins interacting with these cells almost immediately. Viruses cannot reproduce on their own. Instead, they must enter living cells and use the cell's internal machinery to make copies of themselves. When viruses attach to the cells lining the throat, they may begin this process of infection, but the body is not defenseless. The moment these foreign invaders are detected, the immune system begins to react. Specialized cells in the tissues recognize that something unusual is happening. These cells release chemical signals that alert the immune system to the presence of a potential threat. This early warning system triggers inflammation. Inflammation is one of the body's most important protective responses. It increases blood flow to the affected area and allows immune cells to move quickly to the location where they are needed. While this process is essential for fighting infections, it also produces many of the symptoms we associate with illness. In the throat, inflammation can cause swelling, irritation, and increased sensitivity of the tissues. The nerves in the area become more responsive, which is why even simple actions like swallowing or speaking may suddenly feel uncomfortable. This is the sensation we describe as a sore throat. Another factor that contributes to throat irritation is dryness. During the early stages of infection, the normal balance of mucus in the throat can change. Mucus helps keep the tissues moist and protects them from irritation. When this balance shifts, the throat may feel dry or scratchy. At the same time, the immune system is continuing its work. White blood cells begin traveling to the infected area to identify and destroy virus-infected cells. This process is part of the body's natural defense strategy. Even though these internal battles are microscopic, they can create noticeable sensations in the body. This is why a sore throat often feels like the first signal that something is changing inside. It is also worth noting that not every sore throat is caused by infection. Sometimes irritation can occur due to dry air, allergies, excessive talking, or environmental factors like pollution or smoke. However, when a sore throat appears alongside fatigue, mild chills, or general discomfort, it may indicate that the immune system has started responding to a virus. The body is constantly monitoring its environment and reacting to potential threats. Many of these processes happen automatically without us even realizing them. Symptoms like a sore throat are not random. They are part of the body's communication system, signals that tell us the immune system is actively working to protect us. Understanding these signals can help us better recognize how the body responds during the earliest stages of illness. And in the next part of this video, we'll explore what actually happens inside the throat once the immune system begins fighting the virus and why inflammation plays such an important role in the body's defense system. Once the immune system detects that a virus has entered the tissues of the throat, a complex defense process begins almost immediately. The body's goal is simple: stop the virus from spreading deeper into the respiratory system. To do this, immune cells release signaling molecules called cytokines. These chemical messengers act like alarms, telling nearby cells and immune defenses that an infection may be present. As a result, more immune cells begin traveling to the affected area through the bloodstream. This increased activity causes the tissues in the throat to become slightly swollen and more sensitive. Blood flow increases, and the immune system begins attacking virus-infected cells. While this process is essential for protection, it also contributes to the discomfort we recognize as throat pain. Another important factor is the production of mucus. The body may begin producing more mucus in order to trap viruses and remove them from the airways. This is why people often notice throat irritation together with congestion or the feeling of needing to clear their throats. At the same time, sensory nerves in the throat become more active. These nerves are designed to detect irritation and send signals to the brain. When inflammation occurs, the nerves react more strongly, which makes swallowing or speaking feel uncomfortable. Even though the symptoms can feel unpleasant, this response is actually a sign that the immune system is doing exactly what it is supposed to do. The body is identifying the threat, limiting the spread of the virus, and beginning the process of recovery. As the immune response continues, the body gradually works to eliminate the virus and repair the irritated tissues in the throat. Immune cells break down infected cells, remove viral particles, and begin restoring the normal balance of the surrounding tissues. This process may take a few days, which is why sore throats often improve gradually rather than disappearing instantly. During this time, the throat may remain sensitive because the tissues are still inflamed and healing. Swallowing, talking for long periods, or breathing very dry air can sometimes make the irritation feel worse. This does not necessarily mean the infection is getting stronger. In many cases, it simply reflects that the body is still actively repairing the affected area. Hydration can play an important role during this stage. Fluids help keep the throat moist and support the body's natural protective mucus layer. Warm liquids, humid air, and adequate rest may also help reduce irritation while the immune system completes its work. It is also important to remember that most sore throats associated with viral infections improve on their own as the immune system clears the virus. However, if throat pain becomes severe, lasts for many days, or is accompanied by high fever or difficulty swallowing, medical evaluation may be necessary to rule out other causes. The body constantly communicates through signals like these. A sore throat is not simply a random discomfort, it is part of the body's early warning system, alerting us that the immune system has begun responding to something unusual. By understanding these signals, we can better appreciate how the immune system protects the body every day. Even a simple symptom like throat irritation reveals the incredible coordination between immune cells, tissues, and nerves working together to keep us healthy.